Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Upstate has a new clinical trial underway of a vaccine to prevent one of the most common healthcare-associated infections in the world. To learn more about it and how you may be able to participate, I'm talking with Dr. Stephen Thomas. He's the director of the Upstate Global Health Institute and the SUNY Distinguished Professor. Welcome back to The Informed Patient, Dr. Thomas.
Thank you, Amber.
I'd like to start by having you tell us about this common healthcare infection. What is C. diff?
Yeah, so that's an abbreviation for the bacteria Clostridium difficile, which can cause a very, very serious healthcare condition in people who are susceptible. So I'll start with what the condition is. This can cause an asymptomatic infection in certain people. So what that means is you're just a carrier, but it's not actually making you sick. It can cause mild diarrhea. So mild diarrhea would mean people that aren't really impacted in their daily living. They may not even have to seek medical care. But then it can cause more severe disease, a significant diarrhea, abdominal pain. It can bring people to the emergency department. It can get them hospitalized. If it progresses, they may need surgery. They may need to have part of their colon removed. And in some cases, people die. And if you look at data from around 2019, 2020 in the US, over 200,000 people were hospitalized with C. diff diarrhea. And of those hospitalizations, almost 12,000 people died. So that's like twice what the on-center can hold, the number of fatalities we have had. So this is a very significant problem. There's some pretty well-established groups of people who are at risk. It's people over 65 years of age. It's people that have underlying medical conditions which impact their immune system. It's people who have frequent use of antibiotics. And this is one of the reasons why we really try not to use antibiotics in people. And we can talk a little bit later if you want about why that's a risk factor, but people who have frequent use of antibiotics. And it's also people that are frequently interacting with healthcare institutions. So hospitals or skilled nursing facilities or long-term care facilities. These are the types of people that are at high risk for acquiring this bacteria or having the bacteria make them sick.
So what is it about a healthcare setting that increases your risk?
This bacteria, you can have kind of two forms. So one could be sort of the active form, which it's either causing people to become sick or not causing people to become sick. And the way that it makes people sick, it's not the bacteria itself, it's the bacteria produces toxins. And these toxins can impact your gut, can impact your colon and cause you to get sick. But there's also sort of a hibernating form. It's called a spore. You can imagine the bacteria inside kind of this capsule that is protecting it. And it's in that hibernating sort of state. It's very, very resistant to the acids and those sorts of things inside of our gut. It can persist on surfaces for a really, really long time. And so if you think of those risk factors, those people that are at risk that I just mentioned, where do they spend a lot of their time? In healthcare institutions. And they are colonized with this bacteria and they can touch surfaces. These spores can live on surfaces for a long time. Somebody then comes along, touches that surface, they touch their mouth. Now they are infected. And so you can imagine just this cycle of how it can persist. So that's why healthcare institutions are sort of ground zero for these types of infections. But I will say that about 40% of these infections are now coming from the community, partly because we've become a lot better at cleaning hospitals. We've become a lot better at identifying the people who might be carrying this bacteria, and we've become better at treating people.
How is C. diff treated? If someone tests positive for it, do you use antibiotics?
That is a great question from multiple different angles. So the first is that we do not treat people who just test positive, right? So you've heard me say this before. Clinicians make diagnoses, not tests. So even though somebody may test positive, if they are not sick, we don't treat them because you can be colonized with this bacteria, but it may not be making you ill. What will happen though, is when that bacteria goes from the hibernating state to the active state and it starts spitting out these toxins, that's when people can get sick. So when we test people, it's a two-stage test. The first test we do is, do you have the bacteria? The second test we do is, are you actually producing toxins? And so if you are sick and those tests are positive, that's when we treat you. And yes, you are correct. We use specific types of antibiotics to treat this bacteria and to treat the toxins. They're pretty specific for just this bacteria. And they are also good because they are not readily absorbed from the gut. So they stay right where they're supposed to. And if the antibiotics don't work, because if you look at the data for people who get their first occurrence of C. diff, anywhere from 2 to 3 out of 10 people who get an episode of C. diff and get treated will have another episode. And of those people who have a second episode, anywhere from 4 to 6 out of 10 of those people will then go on to have another episode. And now you're kind of in the red zone. You're in a very difficult position here, and you have to try to do other sorts of things. You can use preformed antibodies. Some people require surgery. Unfortunately, they need to have the diseased part of their colon removed. Sometimes people have to have what we call fecal transplants. It's a very complicated process, but basically people get a transplant of bacteria from someone who does not have C. diff into their colon to try and help them develop the type of immune responses they need against those toxins.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Stephen Thomas, the director of the Upstate Global Health Institute, about a clinical trial of a vaccine to prevent C. diff infection. So this sounds a lot different than some of the infections we've talked to you about, where if you have it, then you end up having some sort of immunity to it. It sounds like once you have this, the bacteria stays with you. Is that right?
It can. Again, it depends sort of on the individual and whether or not they can mount an immune response against the toxins. That's sort of the biggest distinguisher of people who get sick versus people who do not get sick. And that is really the target of these vaccines. They're targeting the toxins versus targeting the bacteria themselves. We have a couple of other vaccines that are like that, but this is a unique aspect about this vaccine.
What else can you tell us about this investigational vaccine?
What I can tell you is that it has been tested in over 10,000 people, and it's followed the sort of traditional path of phase 1, 2, 3 kind of trials, where phase 1, small number of people looking primarily at safety. Phase 2, still looking at safety, but also looking at the immune responses in more depth. And then phase 3, which are these really big trials to determine whether or not the vaccine works or not. And it's an interesting story because the last trial that they did, it was a big, huge trial. And this is Pfizer, which is a name that people are pretty familiar with. They did a trial in over 17,000 people, and half of the people got the vaccine, half of the people got placebo. And if you just looked at the top line, you'd say, oh, the trial failed. The reason why you might say that is because they were looking at, did the vaccine prevent a first episode of C. diff in people compared to placebo? And it didn't do a very good job of doing that. And so people, of course, were pretty upset by that. But when they got a little bit more into the details of the trial, what they found was that even though it wasn't very good at preventing that first episode, what it did show is that people who did get C. diff who were vaccinated, they were sick for about a day compared to the people who were not vaccinated, who were sick for on average about 4 days. And then they looked and they said, well, how did the vaccine recipients compare to placebo recipients in terms of needing to go to the doctor? And none of the people who got vaccinated and got C. diff were severe enough that they needed to go to the doctor. In fact, none of the people who got vaccinated and got C. diff actually needed to be treated with antibiotics, and they weren't hospitalized. And so they re-looked at the data and they say, geez, it really didn't prevent very well the first episode of C. diff, but it had a lot of benefits for the patients that it probably is a good idea to try to continue to develop this vaccine and try to hone in a little bit more on who are the most at-risk people and can we benefit them with this vaccine, which is why this current trial is ongoing.
And you're seeking 32,000 participants, not just from Upstate. You're at many sites. Can you tell us where the other sites are?
The trial is, yes, just over 30,000 people. It's going to be around 200 sites in 4 different countries. And again, some people are going to get the vaccine and some people are going to get placebo, which is just sort of salt water. We are specifically looking for people over 65 years of age and people who have risk factors, which I can talk to you about if you're interested. That's the scope of the trial. That's sort of the population that we're focusing on. And this is a really big opportunity, I think, for our community. This community has played significant roles in the development of a lot of vaccines and drugs, whether it's RSV vaccines, certainly COVID vaccines. We work on tropical diseases to protect travelers and our military personnel and their families. This is a huge opportunity. So we're looking for 1,000 volunteers from Central New York, which for a trial that only has about 32,000 people, that's a huge share of the overall enrollment. But I think that we can do it, and I think we should try.
So what are the risk factors that you're looking for? People 65 and older with what?
Anybody who has had antibiotics for more than 2 days in the past 3 to 4 months, that's a risk factor. Anyone that's been to the emergency room twice in the last year, that's a risk factor. If you've been hospitalized for more than 2 days in the past year, then that's a risk factor. If you've gone to either your primary care or your specialty physician or clinician more than 10 times in a year, then that's a risk factor as well. But also people who are planning on being hospitalized for 2 or more nights, let's say for elective surgery, then those are also people that we would like to speak to. So this is, I know just from our clinical practice and the types of patients that we see in the outpatient setting, the types of patients we see in the hospital, this represents a lot of people in Central New York. So I hope that they're listening. I hope that they are interested because I think this is an important opportunity.
Is there anything that would disqualify someone from volunteering?
Yes, if you've ever had C. diff infection before, that would disqualify you. If you've had major surgery on your gut, that might disqualify you. If your immune system does not work well, either due to other infections that you might have or medications that you might take, that would also disqualify you. We go through all of the exclusion criteria in great detail with every individual, but those are some of the major ones.
So for someone considering volunteering, can you walk us through how the trial would work? And also, where would they go to sign up, or how would they learn more about this?
There are a couple different ways that they can get information from us. One is our phone number, one is our website, and one is an email. The phone number is 315-464-5960. And the email is pretty easy to remember. It's trials, so TRIALS at upstate.edu. And then the website is also pretty easy to remember. It's upstateglobalhealth.org. And you have to click a couple of buttons, but it's the clinical trials tab at the top. That would be all the different ways that you can contact us, and we'll tell you all about it. In terms of what is it exactly that I'm going to have to do? So it's the vaccination or placebo. And again, this is a blinded study. So we have no idea until the very end who got what. So it's 2 vaccinations. There are 2 blood draws. We have some safety reviews that are either done in person or through phone. And what we end up doing is once you get enrolled in the study, we will follow you for up to 3 years to see whether or not you end up developing an illness that could be C. diff. And then we work with you to collect samples and to get those samples tested and to figure out what's going on. So it's a long study because it's going to take some time to collect enough cases to be able to make a determination of whether or not the vaccine did what it's supposed to do. But I will say a lot of volunteers actually don't mind that because they feel like when they're part of a trial, they've got this whole team of clinicians and scientists who are looking after them, which is true. They have 24/7, 365 access to us. And so a lot of volunteers actually like that aspect of being part of clinical trials. And people always ask, are the volunteers going to be compensated financially? And I always give the same answer, which is yes, volunteers do get compensated. They get reimbursed for costs, but the compensation is never so much that you should do the trial because of it. You should do the trial if you're truly interested and you truly want to help out. Those should be the reasons why you do it. The compensation is not going to make the decision for you. And that's by design. We don't want that to be the case for people.
Are there any risks of participating?
Yes. And so we talk about when we first meet people, it's called the informed consent process, which is not a one-time thing. It really lasts for the entire duration that you're involved. But we talk about all the potential risks. We talk about all the potential benefits. And the risks would be anytime you're using a needle, right? This is a vaccine. you can have side effects like you get with normal vaccines. And this is one reason why we do all these sequential studies, right? So over 10,000 people have already been vaccinated. So we know that a small percentage of people, they'll have pain where the needle went in, or they might have some swelling in their arm where the needle went in. People might have a headache, or they might have some fatigue that lasts. Most people say it's mild. Mild means it did not disrupt their day in any way. They went to school, they went to work, they did what they needed to do. So most people report that these symptoms, if they get them, are mild and last just a couple of days. So it's those types of things. It's the things that you normally think about when you get vaccinated with your flu vaccine or any kind of routine immunizations. Some vaccines have sort of unique potential side effects. We don't have any with this vaccine. And the over 10,000 people that have been vaccinated so far, that has not been seen. It's all been pretty consistent with what we see from currently licensed vaccines. But again, this is one of the reasons that we do these trials. It's one of the reasons why we conduct them the way that we do, with people being blinded and randomly allocated into certain groups. But again, this is a late stage vaccine because it's been given to thousands of people already.
Well, this is really interesting, and I thank you for making time to tell us about it. And we ought to just let listeners know again, the phone number to call would be 315-464-5960, or a quick email to trials@upstate.edu. Thank you for your time.
Thank you.
My guest has been Dr. Stephen Thomas, a SUNY Distinguished Professor and the Director of the Upstate Global Health Institute. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.